Good evening, everyone, and thank you for joining us. Before we get started with tonight's town hall, I wanted to share a few brief housekeeping announcements. First, we would like to thank everyone who submitted questions in advance of tonight's town hall. We hope to address many of your COVID-19 questions over the next hour with our panelists. And if you have additional questions or need clarification, please use the Q&A function in Zoom. As a reminder, this is a public forum, so anything you type will be visible to others. Tonight's town hall is being recorded and streamed live on Montgomery County social media platforms. Please feel free to share the link so that others can also tune in. And now it's my pleasure to turn it over to our moderator, Dr. Richard Lorraine, to start tonight's town hall.
Well, good evening, and thank you very much for joining us. Tonight, we are presenting the second in the series of COVID-19 VaxFacts virtual town hall series, sponsored by the Montgomery County Immunization Coalition and Montgomery County. I will be your moderator for this evening. I'm Dr. Richard Lorraine, and I will be joined this evening by Dr. Tosha Lee, who is the Associate Medical Director of the Norristown Regional Health Center, Dr. Stephen Shapiro, who is chairman of the Department of Pediatrics at Jefferson, Abington, and Dr. Sarah Smith-Benjamin, who is a faculty member at the Einstein Montgomery Family Medicine Residency. The schedule for this evening is that for the first 35 to 40 minutes, we will be reviewing prepared questions that have come into us from those of you who have registered. And we will address each of those for approximately 3 to 5 minutes. Once we get through that list, we will also be answering questions that you may have this evening. So if anything comes up, please type it into the Q&A, and we will get to those after we have finished the prepared questions. I'd like to start off by asking each of our panelists to introduce themselves and give just a quick basic background of where they come from and what they do in terms of their practice of medicine in Montgomery County. And we will start with Dr. Tosha Lee.
Hi, good evening, everyone. It's so nice to be here with you tonight. Again, I'm Tosha Lee. I'm a family nurse practitioner and the Associate Medical Director at Norristown Regional Health Center. I have been there for about 6 years and have over 20 years experience as a labor and delivery nurse. So plenty of time working in this area with families, with children, and am really glad to share some information with you tonight.
Thank you, Dr. Lee. And Dr. Shapiro. You're on mute.
I'm sorry. Good evening, ladies and gentlemen. Steve Shapiro. I'm a pediatrician in practice in East Norristown. I've been in practice we're into our 43rd year. I practice with 2 other physicians, and we have a general pediatric practice. We've been administering the COVID vaccine to our patients and many others who may have requested it. And we continue to be very strong advocates for the health and safety of children, infants, children, and adolescents. Infants now, to talk about for tonight, children and adolescents for in this era of COVID. So I'm looking forward to having your questions come in and answering the ones that we have had put in front of us.
Thank you, Dr. Shapiro. And Dr. Smith-Benjamin.
Hi, everyone. My name is Sarah Smith-Benjamin. I'm a family medicine doctor. I work at Montgomery Family Practice, which is a family medicine clinic in Norristown. I'm also part of the residency program that is out of that office. I am a resident educator, and I practice all full scope of family medicine from birth, deliveries to all ages. So I'm really excited to be with everybody in the community and talk about this issue today.
Thank you very much. And just briefly, my background as well. I am currently the medical director of the Montgomery County Office of Public Health, position I've held for about 5 years. I'm an internist, and I practiced in Montgomery County for about 37 years. And in addition, I'm also commissioned in the Pennsylvania Air National Guard and currently command a medical detachment. So with those introductions underway, we will get right into our questions. And the first question is directed to Dr. Lee. So Dr. Lee, can you tell us what are the current recommendations for the COVID-19 vaccines for children under 5?
So finally, I'm glad to say it is pretty straightforward. It is recommended that all children over the age of 6 months get a COVID vaccine. And depending on your child's status, there are some recommendations for children who have immunocompromised conditions that maybe they get a booster, which you can discuss with your provider separately. But any child could get either Pfizer or Moderna. They are both authorized under the FDA for vaccination. So finally, all the children 6 months and above can get their COVID vaccines.
Thank you, Dr. Lee. Next for Dr. Shapiro. What should parents know about COVID-19 vaccine safety for kids under 5 and specifically also under 1?
So let me answer this, Rich, by starting off and telling the audience a little bit about where we've come from and, as Dr. Lee said, where we're now going. In contrast to the overall population, I'm going to answer this a little bit differently than just telling you about vaccine safety. COVID-19 is surging in children between 6 months and 4 years. This is the age of our preschoolers. Specifically, since 2021, December of 2021, this is when I could get some numbers, more than 2 million children in this age group have been infected. More than 20,000 have been hospitalized, and unfortunately, 200 have died. In the past 6 months, between October 21 and April, I got the data till April of 22, the rate of symptomatic COVID infection between 6 months and 4 years of age has increased 9-fold as compared to the same time last year. And as you would well expect it to be, because this is the group that's not vaccinated. So if you look at the admissions, 90% of the children admitted for any COVID-related condition have been, of course, not vaccinated. As far as safety, everything you've heard from my colleagues and throughout your neighborhoods and wherever you're taking your information from your physicians, is essentially the same. Just use those examples of maybe a painful arm and a little bit of fever and a little bit of achiness and irritability. Nothing new, nothing that you have to in any way become concerned about that's going to affect this population more in an independent way compared to the others. And I think the last thing you asked, Rich, is what about little kids under the age of a year, 6 months and under? Well, that's where moms, I'm appealing to you to consider vaccinating yourselves. Certainly those mommies who have just given birth and who are nursing and who have been vaccinated are giving their babies some immunity. Under 6 months, we're going to have to rely on moms to do the best for protecting those infants. After 6 months, you can come see any of us and we'll be happy to help you with it. But I wanted to frame the answer in the context of what we know about the infectivity, about the rate of spread of this virus. And this does not even include the new BA4 and 5 variants that we have yet to really get our hands around.
Okay. Thank you, Dr. Shapiro. Dr. Benjamin, so we heard that both Pfizer and Moderna is available for pediatric immunization. Which one should a child get, the Pfizer or the Moderna?
That's a great question, especially when there are options. We want to know which option is the best option to protect our kids. And I think the primary answer really is the option that you have most readily available. All of the studies have shown that both of these vaccines are conferring protection for the children, protection from serious illness and from hospitalization. So if you have both available, that's really great. But either one of these is going to be a great vaccine for anybody to have, including children. Where you can go, where you can find the appointment, where you can find the time to get the shot is really the most important part at this time. We're still learning more information. We're still gathering more information, and we will see down the road if there are slight differences, but slight differences is not really where we're mostly focused at this point, because our goal is to really prevent serious hospitalizations and illness. So there are some slight differences between the series of Moderna and Pfizer vaccine, depending on how old a child is, how sick they are, if they have immunocompromised conditions, how many vaccines they would get in a primary series versus a booster. However, we know as we've gone towards and gone further down our time with COVID-19 and with this pandemic, that changes as we need to boost our immunity. So I wouldn't look at how many shots somebody's going to get as a decision on which vaccine you should get, because we know probably we'll have to get some extra shots later to boost our immunity, especially as the virus is changing. So I would say right now, the Pfizer vaccine, the primary series is 3 vaccinations, 3 vaccines for kids, and the Moderna vaccination is currently 2. But both of them are really great and are going to give us what we need.
So I do have one follow-up question for that, Dr. Benjamin. One of the differences between the Pfizer and the Moderna potentially is when they become effective, how long after the first dose, second dose, and in case of Pfizer, the third dose, when are they truly protective? And that sometimes is an issue that parents are looking at when they decide which vaccine to get. Can you comment on that, please?
Yes, I definitely can. I do think that's a really important thing to consider, because and I think we talk about this later when you're talking about planning, when you're thinking about how long somebody is going to need to plan ahead to get their vaccines before they are immunized and fully protected. The Pfizer vaccine with the series primarily right now is 3 vaccinations. And so the time course of the vaccinations would be 1 dose, then another dose 3 weeks apart, and then the third dose would be 2 months later for the full series. And then about 10 to 12 days after that last dose, you're considered fully protected and immunized. For Moderna, there are 2 vaccinations, and it is approximately 28 days apart from the first and the second dose. And similarly, the time course after for protection is going to be about 10 to 14 days. So the Pfizer vaccine potentially will take a little bit longer for full immunity, just because the series is a little longer.
Okay, thank you. Going back to Dr. Lee, are the COVID-19 vaccine doses for kids the same as for the adults?
They are not. The children COVID vaccine is a smaller dose than the adults, and the dose that they get is based on their age. Tonight, primarily, we are talking about the children under 5, but the dose that the child gets is based on the age at the time that the vaccine was given. But in general, yes, it is smaller than adults.
And I'll just amplify what you just stated. If a child starts the series and gets an immunization based on the age that they have their next birthday, the guidance that we have from CDC is that they should get the dose when they return based on their actual age at that time. So it may be a different vaccine if they age out, if they are 5 or 6 years old.
Yes.
Dr. Shapiro, can the COVID-19 vaccine affect puberty or future fertility in children?
I keep forgetting to unmute.
Unmute.
No, that's my answer. Ladies and gentlemen, we've answered this. I think we've answered this question in every one of these roundtables that I've participated in. The vaccines, the technology, the messenger RNA technology has absolutely no influence on the nuclear material of any cell of your body. It cannot change or in any way modify the nuclear material that is yours. So therefore, the answer to your question is a very simple no.
And we do have data, not on children at this point, but in women of childbearing age, who have gotten the vaccination, and there is no difference in fertility rates
Right.
or successful pregnancy.
Right. I should add, if you don't mind, that the ACOG, American College of Obstetricians and Gynecologists, and all the fertility, reproductive endocrinologists in our area, and all of the societies all have strongly and heartily endorsed the vaccine for mothers contemplating pregnancy, pregnant moms. And as I told you just a few minutes ago, I'd love you to get it, because then I don't have to worry about the first 6 months of baby's life.
Thank you. Dr. Benjamin, and I'm quoting from a question that came in. I feel like I have been waiting for a vaccine for my child, but maybe it's best to wait. Should I wait for back to school or when a worse strain circulates?
Yeah, so that's a great question. And I think we started to kind of talk a little bit about this in my last answer with timing. We have to plan a little bit with the vaccine because of how long it takes for full immunity to really develop. If we're going to wait until the fall for a child to start the Pfizer series, it might take 2 to 3 months to complete and get the full protection that that child would need. And that might actually be a little bit too late. Obviously, we want to protect our children as soon as possible, because should we wait for a new strain to develop? Once we hear about a new strain, it's probably already circulating in our community. We just hadn't had the opportunity to isolate it, to identify it, and to see that it's a different strain than the ones that are already circulating. And since the start of the pandemic in 2020, we've had multiple significant strains that have popped up and then started to widely circulate and change. So to be proactive, to prepare prior to finding a new strain or finding something else that might make it really great that we had the vaccine, the best time to really vaccinate is now, so that you can build that immunity, develop the antibodies, which is what takes about 10 to 14 days after all of the vaccines, and have a full series, either of 2 or 3 shots, depending on which one you get, so that the kids are fully protected as they're about to go into school.
Thank you. Dr. Lee, this is a question that obviously we've heard a whole lot in relation to adults, but should I vaccinate my child if they have already had COVID?
Absolutely, you should, because we know that even after COVID infection, with the vaccine, it just strengthens the immune system even more. And we've been hearing a lot about the different strains of COVID. You can be reinfected after having COVID-19 infection. And so you just have a better chance of fighting off any future exposures to COVID-19 if you have had the vaccination. There are some times where you may want to wait. You know, if you've had COVID-19 already, you can wait up to several months before you get a vaccine. Some people do get infected after they get their, first shot while they're waiting to get the second in the series. And so obviously your isolation needs to be over before you return into, a healthcare center or any type of, public site to get that second shot. But definitely you should still get it. You should complete the series and get any recommended boosters if there are any, even after having infection.
Thank you. One of the comments that I generally make to my patients to help understand this particular question, other coronaviruses cause colds. There are other coronaviruses been out for a very, very long time, and they tend to cause colds. So I always will question my patients, have you ever had a cold? The answer is obviously yes. Then the next question is, well, have you ever had another cold? And the answer is yes. And that's kind of the same idea when you look at reinfections for this particular coronavirus. So because you've had it once doesn't mean that you are immune to it forever. It does help your baseline immunity, and it actually does decrease the probability that you'll get a severe illness going forward. But the immunity does not last forever, and you can get reinfections.
Just add to that, Rich, that there's one group of scientists that's working on a group-wide COVID vaccine, not just specifically COVID-19, but SARS and MERS and other cousins of the COVID-19 virus. They're looking at trying to make a vaccine that will cover all of them.
Yes, and that, should that happen, that would be a great thing.
Yeah.
I will also mention parenthetically that the whole science of vaccinology has taken a quantum leap as a result, unfortunately, of this pandemic. The mRNA vaccines that are the mainstay of our immunization program have been in development for probably a decade or so, but they had not yet come out in general usage. And the pandemic created the need for that to happen. So we are proceeding by leaps and bounds in terms of the field of vaccinology. And Dr. Shapiro, is there a risk for myocarditis if my child gets the COVID-19 vaccine?
So I'm going to ask this in the reverse, because the thing that I know is that COVID vaccination has been proven in other age groups to provide protection against symptomatic infection and the serious consequences of the infection that includes hospitalization, and in adults, the long COVID. We don't see that much of long COVID in children, but we do see multi-systems inflammatory syndrome. And in the aggregate of all of our literature, ladies and gentlemen, the incidence of myocarditis induced from the vaccine is de minimis. I can't give you an exact percentage because it's probably just not reported. You may see it and it resolves. We know what the vaccine does to children now, and with the absence of the 6-month to 4-year-olds. We know what the vaccine does to adults, and we can honestly and completely and thoroughly tell you that the incidence of myocarditis in the vaccinated population is de minimis. But if you get the infection, then all bets are off, and I can't really speak to that. And the myocarditis associated with the adults, Rich, you guys, your adult physicians could help me on that. But that's when the more severe long-term effects can become a real problem.
And I'll just amplify a little bit. The concept that Dr. Shapiro is talking about is risk-benefit ratio. And everything that we do in medicine, every test that we do, every medication that we prescribe, every vaccine that we recommend is subject to a risk-benefit ratio analysis. And we will look at the potential risk of the proposed treatment. We will look at the benefit of the proposed treatment. If the benefit outweighs the risk, we recommend it. If the risk outweighs the benefit, we don't recommend it. So what Dr. Shapiro is saying is that there is a small risk with this vaccine, and actually an even smaller risk in the pediatric population of myocarditis, and a tremendous benefit in terms of preventing the serious COVID disease. So therefore, that's why we would recommend it. Is it entirely risk-free? Of course not. There's nothing that we do that is entirely risk-free. But the benefit so far outweighs the risk that we definitely recommend it. Thank you. Dr. Benjamin, can my child get a COVID-19 vaccine and other vaccines at the same time? Particularly important as we approach back to school.
Yes, it's definitely important because for a long time, children have gotten vaccines and multiple vaccines at the same visit, even as young as 2 months old. And this is actually no different. Kids can get vaccines for COVID, for flu, other vaccinations at the same time. Usually what we recommend is that they are not done in the same arm, but otherwise that can happen. One sort of risk-benefit caveat I do like to talk to people about, and I think this is a helpful time to have an individual discussion with your doctor, is that how you're feeling and your stress level or concern level about the vaccine itself could decide whether or not you wanted to have your child have 1 or 2 vaccines at that time. If you are somebody who wants to have as few visits as possible and would like to have the vaccines done at the same time and get everything over with, that's perfect. If there were ever to be a potential side effect, which sometimes happens, and sometimes we can't always decide exactly what the side effect comes from. It could come from something that's completely unrelated to the vaccine, and most likely it's unrelated to the vaccine. But if we're somebody who wants to be very cautious, having the vaccines done on different days could help you monitor for side effects and potentially not associate a side effect that had nothing to do with the vaccine with the COVID vaccine. So we can make sure that our kids are getting the full series. But the safety shows that, and the data shows that it's safe to get more than 1 vaccine at the same time with the COVID vaccination.
Could I just add a point of practicality to everything you said, Dr. Benjamin? You're spot on. But in real time, ladies and gentlemen, I'm a pediatrician. I'm immunizing children every day. So if you walk into my office and you say, well, can my 9-month-old who's just coming in to get his hepatitis or her hepatitis B vaccine, can I get the COVID vaccine? The answer, as Dr. Benjamin said, is absolutely correct. The problem I have is it's hard for me to open a vial of vaccine to use for one child and then waste, in the 6 months to 4 years, we're getting about 9 doses out of a vial. So please be considerate of the fact that if your practitioner, your family doctor, your pediatrician has a set schedule for vaccination, for COVID vaccination, it's not because we're trying to be difficult. It's just because you can't waste that much vaccine. I know Dr. Walensky said, don't worry about it, waste all you want. But I'm very grateful that I get from the county and from the feds a certain allocation every 10 weeks. And if I run out of it, then somebody misses. So what we've done in our practice is we have a COVID scheduler on our website. Look for them throughout. I'm sure everybody has it. We're not breaking new ground here. But try to understand, ladies and gentlemen, it's just not as easy to just have it available, although I agree with everything Dr. Benjamin said.
Yeah, and just to amplify very specifically, when a vial of the COVID-19 vaccine is opened, it needs to be used within about 6 hours.
Right.
So that's why the scheduling sometimes becomes an issue. And I'll take this opportunity to put in a quick plug for our upcoming flu and COVID vaccination clinics in the fall from the Montgomery County Office of Public Health. So we will be running a number of clinics in various places where we will be offering both flu and COVID vaccine together at the same time. Please be on the alert for announcements about that as we approach the fall. And moving on to Dr. Lee. How do you discuss the risk versus benefit of COVID-19 vaccination with parents of children under 12 years?
So the co-panelists tonight have addressed many of the issues that I myself discussed with parents. We know COVID-19 has been devastating across the world. It's a serious illness. We know that the vaccine works. We know that the vaccine is safe. It was tested in clinical trials. It's been authorized by the FDA. The vaccines are continuously monitored as they've been given, and we know that they protect against serious illness and hospitalization. So the benefit of the vaccine outweighs any risk of maybe a mild side effect. And the side effects of the COVID vaccine in children is pretty much similar to other vaccines that we give children. There is a rare possibility of a serious adverse reaction, very, very rare. And so therefore, the protection that our children and the community get from the vaccine definitely far outweighs any potential risk that there may be affiliated with the vaccine.
Thank you. Dr. Shapiro, will the COVID-19 vaccine become available for children under 6 months?
I think I addressed this just a few minutes ago, ladies and gentlemen. We probably will not address any vaccines to under 6 months of age children, and we're going to rely on mommies to be vaccinated to provide that kind of circulating immunity to their infants, at least for the immediate period of time. And then going forward, obviously, when the baby, the 6-month vaccine is now approved under an EUA and emergency use authorization, and will gradually become approved as a standard tool for us in our practices. So I think for right now, it's safe to say that there will be no other vaccines for under 6 months.
Thank you. Dr. Benjamin, what else can parents do to protect children under 5? And actually, this really translates to pretty much everyone.
Yes, I was going to say the best things that you can do are other things that parents already do, which is mirror and show great responsible behavior that their kids are going to see and pick up, and then start carrying themselves. Good hand hygiene, washing your hands, sneezing into the elbow, not touching surfaces and touching your eyes, wearing masks, and when people feel sick. And I think this is, unfortunately, this pandemic has been very serious, but it has taught a lot of us that when we are feeling sick, when we have a cold, when we think we're going to be contagious, that we should separate ourselves from other people, even if it's not truly COVID, even if it's a viral illness, so that we can respect other people and their health, because we never really know what other people's immune systems are doing. So by acting these hand hygiene, mask wearing, and isolating when being sick, and you're showing that your children under 5 that you're doing this, a lot of children, and I'm sure we have seen on the news, on social media, a lot of children are very easy to pick this up, and they are very dutifully wearing their masks, washing their hands, and using hand sanitizer. And it's become part of their life, which is tough for us sometimes to experience, because that means that they have been going through life in a pandemic for multiple years, but they are very good at picking up these habits. And these are good habits that are going to work for them for forever. So I would say everybody should keep doing what they're doing, and that is going to help everybody.
Thank you. And I'm going to amplify your answer a little bit. The last couple of years, normally in the winter, we'll see a surge of various types of respiratory illnesses, whether it's influenza or RSV or other types of viruses that cause colds. 2 years ago, when everyone was really, really good about mitigation measures, we saw practically no seasonal illnesses. There was almost no flu around. And last winter, we saw less than usual for sure. And this is in large part due to the increased attention that people have paid to these mitigation measures. And not just wearing masks, but washing hands, being careful about touching surfaces and touching your face. And the other thing that I really want to emphasize, that I've been personally talking about this for quite some time, is if you are not feeling well, if your child is not feeling well, if they are sick, the responsible thing to do is to keep them at home, keep yourself at home. I do have to share one other thing that relates to that, because I'm seeing a lot of this right now, particularly with the newer variants of COVID. People who have respiratory symptoms are appropriately checking themselves, doing a test for COVID, doing a home test, which is not 100% accurate. And particularly early on in illness, a test may be negative and may be a false negative. So I'm seeing a whole lot of people having respiratory symptoms. They do a test, the test is negative, so they get sort of a false sense of security. And they're going out in public, and it turns out that in many, many cases, it truly is COVID. They become positive a few days later. In the meantime, they've been spreading this virus. But just as Dr. Benjamin said, even if it's not COVID, if it's another illness, another virus, we would like to prevent transmitting that to other people too. So I'm going to use this time to just throw out that plea there for people who are not feeling well, having an acute illness. Please be careful about exposing other people to that. That is our best way of controlling the transmission. Let's see, Dr. Lee. Are the COVID-19 vaccines, we've kind of addressed this, are the COVID-19 vaccines safe for pregnant people or people thinking of becoming pregnant? But it's such an important point that I think we can revisit it.
So then we're going to repeat, yes, the vaccine is safe. And all healthcare organizations, especially saying gynecology, really recommend the vaccine for pregnancy. And when you are pregnant and get COVID, you do have a higher risk for having complications of COVID. And we do know that during pregnancy, fevers and severe infections can also negatively affect the pregnancy, cause preterm labor and other complications. And so this is a time where, mom wants to be as healthy as possible. And the best way to protect herself from COVID is to get that vaccine as soon as she can, whether it's before the pregnancy or during the pregnancy, and any of those times are fine.
Thank you. Dr. Shapiro, I think we have allocated perhaps a little bit of extra time for the answer to this question. What would you say to people who are hesitant to getting the COVID-19 vaccine?
Thanks, Rich. This one, I don't have much hair on my head, but I was trying to twirl my hair to get the right answer, ladies and gentlemen, for you. And as luck would have it, the Philadelphia Inquirer on Thursday, June 28th, had a wonderful op-ed piece written by a mom. And the title of it is Tears of Joy, My Toddler Can Get COVID Vaccine. I want to just read a little bit of it to you, ladies and gentlemen, because I think this mommy got it. And this is my message to you about the importance of what you're doing for your children, even with the hesitancy in your minds, recognizing that my colleagues on this presentation to you would never offer you anything that would in any way compromise a child's safety or health. So keeping that in mind and knowing the FDA and CDC, all that's in the press. I wanted you to hear what a mom said about what these last years have been like. She begins by talking about her delivery and how difficult it was for people around her to come visit. But then she goes on and becomes very specific, and I'll read this, just bear with me. It's a very short piece. It's been so hard sitting at home, watching group after group get approval to get vaccinated and waiting for our turn. I didn't feel comfortable sending my daughter to daycare or any type of indoor activities without that protection. So she has been isolated for 2 years. She didn't get to experience so many of the things that most babies have before COVID, and that makes me really sad. So when I heard that the US CDC was going to have a vaccine available, I cried with joy. Still, I'm sad for everything we've lost. Now, here's the piece I want you to really kind of focus on. I'm sad for everything we've lost while waiting for this crucial development. I never had a baby shower because I became sick during my 3rd trimester. So I'd planned to have one after my daughter was born when everyone could meet her. But of course, that day never happened, and neither did her 1st or 2nd birthday parties. Since I really never let her out of the house in the beginning of her life, she had a more introverted personality. Everything scared or amazed her. She didn't see a real tree until she was 5 months old. She's often confused by strangers without masks. And she is only now meeting family members who were so close to me growing up, and she's 2 years old. She gets so excited when she sees other babies because she's still mostly around adults. There are so many things she was deprived of in her first years. It amazes me to think that what seems normal to her is so different from how I grew up. Will pandemic era babies ever be able to just run up to another kid on a playground and become best friends for the day without parents arguing about if their kids are vaccinated or if they have a mask before playing together? This generation of children will grow up differently. I realized that when she turned 2 and I gave her a mask and she knew what to do with it. To her, it's the way life is. And I'll stop there to just say that, to me, ladies and gentlemen, answers every one of your concerns. This is a vaccine that's made to normalize our population. We know it's safe. We've given millions of doses, hundreds of millions of doses. And for this population of 20 million children who have suffered a great deal, and that's a mommy talking to you. That's not me. That's not any of my colleagues. That's just a mom who wrote a good op-ed piece. I think you better take this to heart. Have the discussions with your family doctors, your pediatricians, your primary care physicians, and make sure that when you worry about these things, you worry about them in context of what I just shared with you.
Thank you. Dr. Benjamin, I think this question is more related to adult vaccine, but we can certainly include this. If I get my 2nd booster now, will I be eligible for Moderna's variant booster if and when it's available in the fall?
Yeah, this is a great question. And I think this speaks to the fact that while we are making recommendations, we know that things are always changing because the virus is always changing, and we're going to have to make changes to our recommendations and changes to our plans. Having a vaccination now, being protected now, having a full series as it is explained now does not mean that we're going to be ineligible or unable to get the vaccine later. If there's a new vaccine that comes out that has additional protection for new variants, we have been able to have multiple vaccines, and first people had 2 vaccines and now 3. Now there's people who have 4 and 5 and multiple injections, depending on what their medical history is and what their response would be. So we know, and as we've all spoken about today, that the vaccine is very safe, and having an extra vaccination is now that is not going to mean that we are unable or ineligible to get another vaccine later. So I would urge people to always stay up to date now, because we know things can change at a moment's notice. New variants can start to circulate. Having that protection now is going to be beneficial to get us to the point where we're going to be able to get the vaccine later. And that's something that will be studied for children later too, whether or not they need additional doses, whether or not they're going to be able to get the additional boosters. That will all be happening kind of in real time as we're watching it.
Thank you. I'm going to add a note of clarification for those in the audience who may not be following it that closely. What this question relates to is that Moderna actually and Pfizer are both working on newer formulations of their vaccines, which would include the current variants, particularly Omicron, and whether they're looking at whether or not that would be more efficacious. And if so, then that would be substituted possibly in the fall. They are working on that. The FDA did have a meeting recently where they did endorse this idea. The data is only preliminary for right now, so there has not been an actual approval for either of those new vaccines. But there's a very, very good possibility that come the fall, we may be looking at an updated version of the vaccine, which might show more efficacy. So that's what that was referring to. Dr. Shapiro, there was one particular area that you found of interest and you wanted to speak on, and that is the school test to stay program. Can you give us some information on that?
Sure, I'll be very brief. Ladies and gentlemen, OCDEL, O-C-D-E-L, the Office of Child Development and Early Learning, which governs and oversees all of the nursery schools in our community, in our county, has come up with a series of policy statements, that cover the whole issue of COVID. And there's one point I wanted to make you all aware of the new now endorsed policy of what's called test to stay. So that if your child is in a nursery school program and is exposed through no efforts of its own, in terms of it being maybe in a household where a mom or a dad or a sibling becomes ill from COVID, contracts COVID, your child, if the child remains well, and certainly this is a big endorsement of vaccination here in terms of your schedules that you'd want to keep. But even be that as it may, it is now clarified that if your child is well, you can be accepted you can send that child, instead of having to isolate the whole family, that child can return to the nursery school and have a daily COVID antigen test performed. And if in fact the child is negative, they can have a test that negative, they can go back to nursery school. There will be a contingency to have children vaccinated, and that this will apply mostly to the vaccinated population once that population is invested with the vaccine. But I think you can understand the benefit of knowing that if you have the vaccine on board and you test to stay, the test to stay is 5 days, after which the child is cleared to return to continue without further testing. And that's a key element to your day-to-day routines, your work life, schedules for the other children in the family, and for dad and mom as well. And I think you should just be aware of that new concept that has been approved and hopefully will be available to you in your nursery schools.
So this basically refers to one of the issues that Dr. Shapiro raised when he read that article from the Inquirer, and that is trying to normalize the childhood experience. Over the past few years, particularly in schools, there's been a lot of issues in terms of classes being canceled, having them remotely. The kids don't have the chance to socialize appropriately. We know that there is potential harm from this. And this is a method to try to mitigate that as much as possible, try to have the kids stay in school. The Montgomery County Office of Public Health is very, very active in the Test to Stay program. We put together guidelines that we've put out to all of the schools, and the school districts are very, very responsive and interested because their goal is to try to preserve that school experience for the kids. And this is something very, very important for us going forward. So we have reached the end of our submitted questions, and we do have a few questions that have been typed into the Q&A, which we now do have time to go over. So I'll address the first one to Dr. Lee. How effective is the vaccine against reinfection? And does previous infection with COVID help protect children against the virus?
So previous COVID infection, the level of protection that you get from that alone without vaccination can vary, and it's based on many, many things. And sometimes things we don't always know. How sick were you? What was your viral load? And other factors. However, having the vaccine after infection will help protection. Now, does it 100% protect you from reinfection? No. Even with the vaccine, you can get reinfected. But we do know with the vaccine, if you get reinfected, you are far less likely to have serious illness and hospitalization. And that's really what we're trying to prevent here. We've been dealing with all types of viral illnesses, colds, upper respiratory infections that are relatively minor. And so if it's minor and it's not causing any long-term consequences or any serious complications, we can move forward from that. What we really want to prevent here is serious complications, hospitalization, and of course, in the worst case scenario, death. And that is what we do know the vaccine is effective against.
Thank you. This next question, I'm just going to open this up to anyone in the panel who would like to answer it. Did the kids in the trials receive COVID and other vaccines at the same time?
I can answer that one, Rich. They did not. This was a singular study. Children are never in a double-blinded study. In this case, we either gave the child the vaccine or they didn't get the vaccine. They got a placebo injection for the sake of statistics. But in no case were the children receiving multiple doses of their DPT or polio or measles or any other vaccines.
And there is a reason for that too. That
Sure.
would have confused things in terms of the trial, because very, very important during these clinical trials is to evaluate possible side effects and negative effects of the vaccine. And if you're not controlling for these other circumstances, it may be confusing as to whether or not a side effect or a condition might relate to the vaccine itself.
Right.
This one I will give to Dr. Benjamin. And this is a good question. From my understanding, only 386 children were in the Pfizer trial for children under 2. Can you address this being such a small number?
Yeah, so I can just say that I was quickly looking at the emergency use authorization document for the Pfizer vaccine for children under 5. When I pull up the study data and look at what they quantify, they look at children 6 months through 4 years of age in a large group. Initially in their phase 1 trial, which is just when we look to see if the vaccine has any negative side effects or causes any problems, there's lower number of people that are usually in the study because we just need to look, is it causing problems or not? That phase 1 had about 32 children. In phase 2 and 3 trials, there were 3,013 children from 6 months to 4 years of age who received the vaccine. Now, this is a higher dose, and this is actually looking for efficacy and gave the data that allowed for the emergency use authorization. So I can't comment specifically on 2 years and under. They did not pull that, so I can't find where this specific 386 number is from. But when we look overall and we look at children, yes, children at different stages, in different ages, may have different responses, but we can also look at children as a larger group of people who are growing and developing and going through different phases, and make some comparisons, especially when we're making sure that we're looking at the data regarding safety first and making sure everything is safe, and then looking at the data later and looking at efficacy. We unfortunately have a difficult time with clinical trials in general, and that has been an issue in the pandemic. Getting people to be able to volunteer for trials, getting people to not only volunteer for the trial, but then be able to come back multiple times, get tests, et cetera, and multiple blood tests, testing antibodies, reporting information, multiple COVID tests is something that could be a little bit burdensome or hard for children under 2 years old. So that is a potential reason why there might not be as many, but I can't comment specifically on that number, because when I look, I see about 3,000 children from 6 months to 4 years who were in the phase 2 and 3 trials.
Could I add to this, Rich? Dr. Benjamin, spot on. But the thing that made these vaccines, let's just go back to 2020, 2021, made these vaccines available to us so quickly. The standard approach to vaccinology is you have phase 1, 2, 3 trials. The phase 3 trial is the pre-delivery trial that just proves that the vaccine works and is usable in the community. What the FDA and CDC did, and what Pfizer and Moderna did magnificently, was they ran phase 1, phase 2, and phase 3 simultaneously. So it may be that the number of children in the proof of concept, the phase 1 trial, was a limited number because they didn't need a lot of numbers. They just had to do it, make sure the vaccine was doing what it was supposed to do. And then in the larger trials, the phase 2 trial probably was the dosimetry trial, where they tried the different doses. And if you'll notice, the dose of Pfizer is about 1/10 of the adult dose, and the Moderna dose is, I think, what I read it somewhere, I don't remember it off the top of my head, maybe 75%, about 3/4 or something like that. But the two companies ran these studies in parallel. So they were pulling data from one study to the next to the next. You didn't need thousands of kids in the study until you got to phase 3. And then, as Dr. Benjamin clearly stated, that's when the study was the 3,000 children. I knew it to be around 3,000 as well. But to your point, there could have been smaller numbers in some of the earlier trials.
And when you look at how clinical trials are conducted, the amount of individuals who are in those trials is always very, very small compared to the number of people who will eventually either receive the medication or the vaccine. So what's really, really also important as part of that is the post-marketing surveillance. So during a clinical trial, you may have hundreds to thousands of people getting a medication or a vaccine. Once it is approved and marketed, you will have tens of thousands, hundreds of thousands, or in this case, hundreds of millions of people getting it. So therefore, you will have relatively uncommon and rare side effects appear in a larger number because you've got a much larger population. So it's very, very important that once this medication or vaccine is approved, that there's a good method of surveilling and maintaining awareness of any negative effects that may come up. There's our standard reporting mechanism for this, but there's also the vSafe mechanism, which is essentially an app that people will download on their phone. Many of you have probably experienced when you've gotten your own vaccination, and it will actually remind people to report on how they're doing. So there's a whole lot more data that's being actively collected on this vaccine than has ever been done before. So post-marketing, we are keeping a very, very close eye on these vaccines. And I think that was the last question that we had. Yep. Okay. So we do not have any more questions pending, and we are right on time. This is absolutely amazing. What we will do in the final wrap up, I will ask each of our panelists to just give us a comment or two on whatever they think is really, really important to get across to, in this case, parents of our children under 5. We'll start with Dr. Lee.
Sure. So obviously, it is no secret that this panel here strongly recommends the vaccine for children under 5. But we do know that parents have concerns. They have questions. They might be reluctant. And if you do, please keep the conversation open. That is what I would really like to encourage everyone. Go to your healthcare provider, whatever concern you might have, whatever question you might have, whatever reason might be holding you back from making a decision, just discuss it. And even if you don't come to a decision at that visit, you'll be back and keep discussing it until all of your questions are answered. There is no question that is too silly. There is, nothing that you can't discuss with your healthcare provider for which you cannot get an answer to. And then take that information to make your decision. Try as hard as you can to block out some of the extra noise you might be hearing, some of the myths, some of the information that's just kind of, circulating on the internet or on social media. Make sure you have the facts and make sure the answers that you get suit your needs so that you can make a good decision for your child that, really is going to affect your child for the rest of their lives, basically, or at least until that child can make a decision on their own, when they're in their later years. So this is an important decision that you're making. Take it very seriously and make it based on sound information.
Thank you, Dr. Lee. Dr. Shapiro.
Thank you, ladies and gentlemen, for participating. As you heard when I read that piece, my world has been all involved with the children almost exclusively. And when the 12-year-olds could be vaccinated, that provided a little bit more normality to the family. And then when the 4 to 10-year-old, 11-year-olds could get vaccinated, the family got a little more normal. And then now that this last vulnerable group has reached this pinnacle of success and opportunity, I want you to think about how far we've come, how many people's lives have been lost because we didn't have something. And going forward, think about the as that mom that I read that piece from, think about yourselves in that situation, trying to sort of make, get back to some basis that made sense for you and your family. I don't want to define normal. There's no such thing as a definition, but it's whatever your family likes to be doing and wants to do together, and just not have to worry about this such a difficult virus that we didn't know much about, that has a completely different understanding 2.5, 3 years later. So I urge you to think about it carefully, as Dr. Lee mentioned, but do understand that the science has really turned us around, and we're just not having to deal with some of those horrible days in the past 2 years. And thank you very much for considering this for your children. I think you really deserve a great amount of credit for wanting to listen and hear and make decisions for yourselves, as Dr. Lee said. Thank you.
Thank you, Dr. Shapiro. And Dr. Benjamin, take us home.
Yeah, well, to build off of what everybody has said, a lot of things have happened in the last several years, and this is just another amazing step forward that we're able to take in order to protect as many people as possible and prevent as much spread as possible, and get us to a point where we are able to reduce transmission, because there's a lot of transmission going around, especially now that we have a lot of people who are testing at home. We're not seeing as much the data, and we still really need to make sure we're reducing COVID infections and preventing severe infections. I know a lot of people have concerns, and I know that a lot of parents want to do the thing that is the best and the safest for their children. And a lot of things that we've talked about today have just highlighted the fact that this has been studied in almost every patient population possible. And in children, it's